When someone is dying, pain is not automatic. What I mean by that is that just because someone is at the end of life, just because someone is dying, doesn't mean that they automatically feel or experience pain. But how do you know that a person is not in pain and not suffering when they're actively dying? Actively dying is the hours to days before death when that person is usually, in most cases, unconscious. And so, in that time, how do you know? How do you know if they can't tell you? Well, we're looking at their nonverbals, we're looking at their body language. So, when I think about, for example, babies are not able to communicate, they're not able to verbalize how they're feeling. And so, what do we do as parents to kind of assess if our baby is uncomfortable, if they're in distress in some way? Well, we're going to read their body language, their nonverbals. Are they crying? Are they grimacing? Are they restless? We're looking at their body language and we're responding to that body language. The same thing is going to happen when someone is at the end of life, when someone is actively dying and they're not able to communicate or verbalize with us. We're going to look at those nonverbals. So, are they grimacing? Are they frowning? Are they scrunching their eyebrows? Are they really tense? Is their body tense? Is it rigid? Are they squirming in their bed? Are they restless and agitated? Maybe they're kicking their clothes off or they're kicking the blankets off. We're looking at it again like a baby. They're not comfortable in some way. There's something going on here. And so typically we're going to treat it as such. If the person, on the other hand, is lying in their bed, they're completely still. They look relaxed. Now, their eyes might be open, their jaw might be open and relaxed. They might be breathing funny and making some funny noises, that rattling or gurgling noise, but these are all normal signs of the dying process. And so, if their facial expressions and their body language are calm and relaxed, then we can imagine that they're comfortable. My name is Katie Duncan. I'm a nurse practitioner and an end of life coach. Our next certified death doula training is starting in September. You can find out more in our free training at deathcarecoach.com.